When you're ready, Denise, you can call the roll.
Kiana, we are ready to begin. It's 10:30. And with the chairman's direction, I will begin with the roll call. Norman Boyd.
Here.
Roger Folsom.
Here.
Russell Crutchfield.
Here.
David Cruz.
Here.
Anthony Williamson. Anthony Williamson. Nelva Lee.
Here.
Thank you. Cynthia Rucker.
Here.
Russ Childers.
Here.
Kenneth Davis. Kenneth Davis. And I'll ask one more time, Anthony Williamson. That concludes my roll call, Chairman.
Thank you, Denisha. And I believe that is a quorum that we have so we can conduct our business today. And I welcome all of you to our Zoom call today. And we have a rather brief agenda today. 2 items to consider. We have 2 new board members to introduce, and I'll do that in a little bit. But just to kind of explain our format for the benefit of the new members, we'll have 2 items today that we'll receive presentation on from the staff and be asked to vote on. One for final adoption and one for initial adoption. And in our process to kind of explain those procedures, final adoption means that we have received, if any, public comment, and it is being asked for us to consider for, as it says, final adoption. The second issue that we will consider, you will note the item saying initial adoption, and that means that this will be the first time we will hear that presentation. And following initial adoption, as is the process, this will go out for public comment, and the presenter will explain that when it is presented, but so that we understand how that procedure works. So next on the agenda, I would call on our secretary, Russell Crutchfield, to see if he has read the minutes of the August 26th meeting, September 9th meeting, and if he recommends that those minutes be approved. Russell?
Well, good morning, Mr. Chairman, and welcome to our new members of the board. I have reviewed the board meeting minutes for the August 26th and September 9th meetings, and I have found them to be correct and in order, and I recommend approval for the August 26th and September 9th board meeting minutes.
Okay, our secretary has recommended that those minutes be approved. Is there a second to that motion?
Second.
Roger Folsom, second, Mr. Chairman.
Roger Folsom has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, the minutes are approved. Moving to opening comment section, as I said, I'd like to welcome 2 new members to our board today. We're pleased to have them with us, and Dr. Neville Lee is a founder and developer of the Medical Interpreting Translating Institute. And we will ask if Dr. Lee would please make some comments and introduce herself to the board, please.
Good morning. Again, I'm Dr. Nelva Lee. Not only am I the founder of the Medical Interpreting Institute, but I also have a background in healthcare as not only as a nursing home administrator, but also working as a director at Grady Health System. So I have over 20 years of healthcare experience, and I'm very happy to be on the board. I believe I'll be able to add some real world experience to the board and insight.
Thank you very much, Dr. Lee. And yes, your background will be a valuable asset to our board, I'm sure. Next is Dr. Cynthia Rucker, clinical nurse manager of the Atlanta VA healthcare system. And Dr. Rucker, would you please make some comments to introduce yourself to the board?
Hello, all. Excited about being a part of this board. I have been a registered nurse for over 23 years, and I also bring a lot of healthcare experience, also administrative and managerial. Thank you again.
Well, thank you for your willingness to both of you, for your willingness to serve the state of Georgia and the Department of Community Health in helping us as oversight and advice to the department as they pursue their mission of a healthy Georgia. With that, the next on the agenda is the Commissioner's report, and Ryan Loki, Deputy Commissioner of Chief Health Policy Officer, will be giving the Commissioner's report today. So Ryan, would you please proceed?
Yes, sir. Thank you, Mr. Chairman, and thank you, members of the board, for allowing me to stand in for Commissioner Noggle today. She is actually on her way to accomplish a pretty incredible physical feat that I'll let her tell you about when she gets back. But we're all excited and proud of her and thinking about her over the course of the next couple of days. Wanted to take a moment again and echo your comments, Mr. Chairman, and welcoming Dr. Rucker and Dr. Lee to the board. I've had the opportunity to spend a little bit of time with the both of them over the course of the last couple of weeks since they were both sworn in. And I'm very excited to have their background and experience and expertise with us as we kind of transition into this new leadership with Commissioner Noggle at the helm. I'd also like to take a moment and thank Mark Trail for his many years of dedicated service to this board. Mr. Trail was a friend and constant wealth of knowledge to both the board, the department leadership and staff over the course of many years, and I want to thank him for his dedicated years of service. A few operational updates, Mr. Chairman, that Commissioner Noggle has asked me to share with you guys this morning. Over the course of the last couple of weeks and continuing over the next few weeks, she and I and a couple members of our staff have done a little bit of a roadshow across the state, getting to meet with both our hospital partners, provider groups, CMO leadership, TPA leadership, many associations, and gotten a chance to really hear the perspective of several of these groups about, their workings, their interactions, their happiness and their displeasure as well with anything that the department is doing. And from that, the commissioner and I and the team that's been going with us have really kind of stressed kind of three key areas that we're focusing on over the course of the next few months or so. And she's talked about this before, but focusing primarily on quality in everything that we do and all the services that we provide. Looking primarily at customer service and customer experience, and through our vendors and our partners and our contracts team and the staff that work with us and our sister agencies, how do we provide the highest possible customer experience and the best customer service to the people that we serve? And then finally, finding ways to lead with data and make data-driven decisions. And through the course of these conversations, we've actually identified two relatively minor areas that we think will help improve the department's ability to respond both from a vaccine standpoint and then also address some of the infant and maternal mortality issues that we've been able to glean primarily through a partnership with the Georgia Academy of Pediatrics and Rick Ward and his team. Two areas that I want to call to your attention. First, a couple of weeks ago, we opened up in the Medicaid program a vaccine counseling code. This came at the request of the pediatricians as well as our partners at Public Health to allow for reimbursement for providers who were counseling or providing perspective on the benefits of getting the COVID vaccine. Lynette Rhodes and Brian Dowd and their team worked very quickly to get that turned on, and that's now in place, and we started to see some uptake in that and excited about that. The next piece that has not been turned on yet, but will be over the course of the next few weeks, is we are going to allow for reimbursement for donor breast milk. Again, in our conversations with our public health partners and the pediatricians, we've identified that there's a real opportunity at a fairly cost-effective level to provide reimbursement for donor breast milk for extremely premature babies to assist in their early growth and development. And that code will be opened up over the course of the next few weeks. So excited about those two things. And there's many more things like that we hope to come given the course of our conversations and our travels over the next few weeks or so. A couple other just quick updates. The state health benefit plan open enrollment begins next Monday for a little north of 675,000 SHBP members. That will last through November 5th. I'm incredibly proud to work with Louis Amos and his team at SHBP. They've done an incredible amount of work over the last few weeks getting prepared for open enrollment, and wish them the best and hope that it's successful. Last piece, Mr. Chairman, that I'll mention, and then I'd like to celebrate a little bit of employee milestones, if you'll indulge me. Just wanted to close the loop on a topic that Commissioner Noggle has shared with you guys before, and it was actually one of the first conversations I believe she had with the board regarding EPSDT. You'll recall that in July, there were a series of news articles that came out that showed that Georgia was performing well below the national average in our peer states and EPSDT screenings and referrals. And the Commissioner shared last time that under Lynette Rhodes and her team's leadership, working with a partner that we've got, went back and really tried to identify, hey, is this a real thing, or is there a data issue? Is there a reporting issue? You know, what's going on here? We don't actually think that we're well below every other state in this space. And the Commissioner shared last time that the initial findings were that it was a reporting error dealing with timing of the data collection between various systems. And since the last board meeting, we've completed that report and have their findings, and did indeed confirm that it was a reporting error dealing with the timing of collection against various different data systems. And one piece that I'd like to call out for you, just to kind of signify the magnitude of the reporting challenges that occurred. We went back and looked at specific instances in what's called a CMS 416 report related to EPSDT screenings. And in the news articles and some of the follow-up that we got from provider organizations and advocacy groups, one of the areas that was called out was the total eligibles referred for corrective treatment. And the number was 23,000, which was incredibly low that we thought. And through the course of this work, again, under Lynette's leadership, we actually went back and confirmed that the actual number is 452,000 eligibles that have been referred for corrective treatment. So again, we're working quickly with our teams to see if we can rectify the reporting issue. It's incredibly complex, as I've learned working with Lynette over the past couple months on this or so, but wanted you to have some comfort that we're not actually below every single state in this space, that it was indeed a reporting error. And then lastly, Mr. Chairman, if you'll indulge me, I'd like to continue what the Commissioner started, I believe, 2 board meetings ago, and celebrate some employee milestones with you and the board. William Bulkey, Stephen Gottney, and Shauna Sears are celebrating 5 years of state service this month. Lavinia Luca and Antonio Rios are celebrating 10 years of state service this month. Karen Brown is celebrating 15 years of state service this month. And Itovia Evans is celebrating 20 years of state service this month. So I wanted to take a moment and thank those incredible individuals for their passion and their dedication to DCH in the state of Georgia. So with that, Mr. Chairman, that concludes my report. I'm happy to take any questions if there are any.
Thank you, Ryan. Very positive news in those comments, and we appreciate that very much. And are there comments for Ryan from the board? Comments or questions, please? Hearing none. Thank you again for your comprehensive report, sir. Next item on the agenda, we will be asked to consider for final adoption is medical assistance plan, state plan amendment changes to disproportionate share hospital allocation methodology. And we will have Kim Morris, our Director of Reimbursement and Financial Management, will make the presentation. So Kim, please do.
Good morning. Today I'm presenting for final adoption a proposal to revise the definition of individuals eligible for exclusion in the disproportionate share DSH and calculation for uncompensated care as required by the Consolidated Appropriations Act of 2021. The act limits individuals to those where Medicaid is the primary payer for Medicaid assistance and the uninsured. The change eliminates individuals where Medicaid is the secondary payer. The revised definition will not impact the state's total DSH funds. An opportunity for public comments were held on September 14, 2021 at 11 a.m. via WebEx. Written comments were due on or before September 21st, 2021. There were no oral or written comments. At this time, I'll pause to see if there are any questions.
Any questions or comments from the board, please? Hearing none, just for, again, for knowledge for the new members. As Kim said, there were no oral or written comments. This went out for public review. I would say that is not particularly normal. Normally, we have comments, either oral or written. And when we do, as board members, when you receive your materials for the upcoming meeting that Denisha sends out in advance, you will get copies of that public comment, either in summary form in the case of oral comments or actual copies of the written comments. So when you see those come with in future agendas, you will understand that. So with that, if there are no questions or comments at this time from the board, I will call to see if there is a motion that this be approved for final adoption.
Russ Childers moves for adoption.
Russell Crutchfield has moved for approval for final adoption. Is there a second?
Second, Anthony Williamson.
Anthony Williamson, thanks, Anthony, for joining us. And he is seconded that motion. All in favor, say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, it is approved for final adoption, and thank you very much, Kim. Thank you.
Thank you.
Thank you for being here today. The next item that we'll be asked to consider for initial adoption will be presented by Brian Pedersen, who is Attorney, Healthcare Facility Regulation Division. So, Brian, please proceed.
Good morning, Mr. Chairman Boyd, Deputy Commissioner Loke, and members of the board. The Division of Healthcare Facility Regulation presents rules for initial adoption for nursing homes. These rules are found in Chapter 111-856 of the Department's Rules and Regulations. These revisions of the nursing home rules are necessary for the department so that the nursing home rules comply with State Bill 215, a bill to be entitled an act to amend Article 1 of Chapter 7 of Title 31 of the Official Code of Georgia annotated. And this bill pertains to regulation of hospitals and related institutions, including nursing homes. The proposed revisions would authorize the use of certified medication aids in nursing homes and allow certified medication aids to administer certain medications to nursing home residents under certain circumstances, and to provide criteria and requirements for ongoing medication and skills training and the prohibition of narcotics administration by such certified medication aids. To summarize these proposed changes, the new rules would authorize nursing homes to employ and use certified medication aids to administer certain medications to nursing home residents, much like what is currently allowed in the rules and regulations concerning personal care home and assisted living facilities. The new rules would allow CNAs to become certified medication aids after they have undergone medication and medication administration training, testing, registration with a state registry, and be under on-location oversight. Additionally, the new rules require all nursing homes choosing to use certified medication aids to conduct annual skills competency checks, quarterly random medication administration observations, and other recertification processes, as well as continuing medication administration training for each certified medication aid the home chooses to employ. The new rules detail what medications a certified medication aid may administer to a nursing home resident and explicitly prohibits certified medication aids employed by a nursing home from administering any Schedule II controlled substances that are a narcotic. An opportunity for public comment will be held on Tuesday, November 16th, 2021 at 10 a.m. via WebEx audio. Individuals wishing to comment in writing on any of the proposed changes to the nursing home rules should do so on or before 5 p.m. on Friday, November 19th, 2021. At this time, Mr. Chairman, I'm more than happy to answer any questions that any board member may have regarding the proposed rule changes to the nursing home regulations.
Are there any questions or comments from the board, please?
This is Dr. Lee.
Yes, please go ahead.
So would this require the CNAs to have experience before they apply for the medication, to have the extra medication training?
In order for them to even become a certified medication aid, they will have to go through specific training that are detailed in the rules amendments with regards to medication administration, medications in general, and then go through on-site or observatory training with regards to the medication administration. And there are several other requirements with regards to on-site monitoring of the certified medication aids after they are certified by the state.
Okay, but a brand new nurse, a CNA basically could go through this process.
You are correct, yes. There is no prohibition on a brand new CNA.
Any other questions or comments, please?
This is Cynthia Rucker. You mentioned that that the aids are being used in assisted living and another area. What was that other area?
They're currently authorized under the department's rules to be used in personal care home and assisted living facilities.
Okay, thank you.
You're welcome.
Any other, I'm sorry, please go ahead.
This is David Cruz.
Yes.
Who will be providing this training and certification?
The certification for the state registry is done by a third party for the state Alliant Healthcare Solutions. And the training course is already set up through them. And as with the personal care home and the assisted living facility rules and regulations, the individual nursing homes would be allowed to follow the state regulated training program in order to certify the medication aids.
Any other questions, comments? Hearing none, is there a motion for approval for initial adoption for this to go out for public comment?
This is Dr. Lee. I'll make a motion.
Your motion has been made for an initial adoption approval. Is there a second?
This is David Cruz, I second.
David Cruz has seconded that motion. All in favor, say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, it is approved, Brian, and we'll look forward to seeing the public comment, and you're coming back, I assume, for a final adoption after you have made changes or whatever may come out of the public comment period.
Thank you, Mr.
Okay.
Chairman.
Thank you very much for being here this morning and making your presentations to both of you.
My pleasure.
And thanks to Tanisha and the department for supplying us all the information a week in advance of the meetings, which is our normal procedure, which gives the board members a chance to review the materials prior to the meetings. Our next meeting will be on November 18, on Thursday, November 18 at the same time, and you will be receiving information from Tanisha on that and the contacts that you will need. Is there at this time, is there anyone who knows of any new business that needs to come before the board at this time? Hearing none, I again thank all of you for your participation today, and with that, the meeting will be adjourned. Have a nice day and thank you. Goodbye.
Thank you.
Thank you.
Thank you.